Good evening to all of you, and thank you for joining us here on 13 Plus. I'm Mary Coleman. A very happy Tuesday to you. Well, let's jump right into our story for this evening. A woman who asked for medical attention died behind bars, and now a healthcare provider for inmates is facing some pretty tough questions. Our national investigative team looks at the case and explains what happened and some possible solutions.
A woman who asked for medical attention multiple times dies behind bars. I'm Lee Zurich.
And I'm Tisha Powell. Now the nation's largest prison healthcare provider is accused of putting lives in danger. Detention centers across the country use their service to care for inmates, but a wrongful death lawsuit out of Georgia claims doctors failed to do their job.
Investigative reporter Andy Perotti takes an in-depth look at the case and will show you a new tech solution designed to save lives.
Code blue. Delta 6.
A Cobb County Sheriff deputy rushes to a call of a detainee having a medical emergency.
She's gasping for air at this time.
When he arrives, he finds Brittany Sharp surrounded by jail staff trying to keep her alive.
Signal for fire and rescue are en route.
William Stevens is Brittany's younger brother. Their father called him with the news.
And he was like, yeah, your sister's on life support. And I just kind of lost it.
26 days later, Brittany died. She was in custody facing pending drug charges. While the medical examiner said she died from natural causes listed as heart failure, we uncovered court filings that claim the 34-year-old repeatedly requested medical help days before she collapsed, but was never evaluated. On July 11, 2022, this jail form shows Brittany notified staff about hot and cold flashes, chest pain, and numbness in her hand. Security video shows Brittany speaking to a paramedic in the infirmary. She's never evaluated by a nurse or doctor. The paramedic wrote Brittany was suffering from anxiety issues and sent her back to her cell.
We have a paramedic who's not trained or licensed to make a medical diagnosis, actually documenting a medical diagnosis.
Lori Roscoe is a nurse practitioner and has nearly 30 years of experience in correctional health.
So bottom line for you, he wasn't qualified to make that diagnosis.
That's correct.
When she returned to her cell, Brittany continued to complain about her condition. Listen to this call between a deputy and an infirmary employee.
She says that she has numbness like in her arms and her legs, and she says she's been seen by the infirmary.
Yeah, she said she had chest pain earlier today.
But according to the lawsuit, that wasn't true. Jail documents show Brittany was at the infirmary nearly 2 days before this phone call.
They say she appeared having anxiety issues.
Okay, so leave her in there.
Yeah.
Did that infirmary staff member make the right call?
No, in my opinion, she did not. When she received a phone call from the sergeant stating that Ms. Sharp was presenting now with new and different signs and symptoms, she should have immediately sent Ms. Sharp to the medical department.
She went to the infirmary. They said, what?
According to recorded interviews with sheriff investigators, nearly every detainee in Brittany's pod said she repeatedly asked for help.
She had complained to about every different shift, tried to get the medical.
Everyone was ignoring her.
Nobody cares about us, so she was just like,
not true.
yeah, that's very true. When you're behind these bars and you're telling people that you need medical and they don't come, they don't care.
The Cobb County Sheriff doesn't employ his own medical staff. The Sheriff's Office pays WellPath Health millions of dollars a year to provide care for its detainees. And this isn't the first time the company has been accused of failing to do its job.
This was in reference to the inmate that passed away.
Here's a deputy speaking to an investigator in 2021. WellPath was the medical provider at the time.
I have words and the nurse is stated, oh, this inmate is having chest pain.
Well, he's just gonna have to wait. I had a nurse shut the door in my face.
According to the Project on Government Oversight, WellPath and its subsidiaries have faced nearly 1,400 lawsuits nationwide over the past decade, accusing it of exposing detainees to contaminated insulin, failing to give a man his HIV medicine, and medical neglect. 2 U.S. senators sent this letter to WellPath after receiving complaints about outright denials of care and inadequate staffing.
She's at her grandmother's house.
Days before Brittany went unconscious, she called her brother.
I'm ready to see y'all, man. I'm closer now.
A reunion that will never happen, following days of asking for medical help that allegedly never came.
I love you so much, brother. I love you so much.
I love you, Pastor Mo.
I love you, Pastor Mo, too. I'll talk to you later, okay?
WellPath did not respond to requests for comment about the allegations, but denies wrongdoing in court filings.
A bipartisan Senate report found deaths in custody are going undercounted and are oftentimes poorly tracked. To help get inmates the care they need faster, a detention center outside Washington, D.C. is testing biometric sensors that can be worn on a wrist or ankle. They monitor an inmate's heart and respiratory rates as well as movement and are designed to immediately alert jail staff in the event of a medical emergency.
You know, we're not putting these devices on and just sitting back and waiting to hear an alarm. We're still doing our visual rounds, our security rounds. What I want to capture are those seconds and minutes in between.
Critics of the technology stress the sensors should come with privacy protections and guidelines about how the data collected from the inmates will be used.
Having additional tools for correctional facilities to be able to monitor that on the health-related context makes sense. But what happens with these technologies is there's an enticement to use it for other stuff.
You can learn more about the high-tech approach on investigatetv.com. Just search inmate safety.
Well, friends, be sure to download our 13 News app where you can get all of our latest news and our push alerts, no matter what it is we are covering. For now, we will leave you with the live look from our Mount Bigelow camera. We hope you're staying cool out there because Lord knows it has been a chilly one today. We hope you'll join us for more news and weather coming up on 13 News Live at 10 tonight. Have a good one.